Hey everybody, it's Paul Ramsey, and I am joined by Ron Eslinger, who is, first of all, he was my CI instructor with the Guild years ago, and so I love hanging out with him and getting time with him. He's going to actually be presenting a 2-day pre-convention workshop. Okay, so you'll notice it's the convention is the 11th, 12th, and 13th. This is on August 9th and 10th, and it's an advanced pain practitioner certification with Ron Eslinger. How are you, Ron?
I'm doing great, Paul. It's so great to see you again. You look great.
Thank you. Yeah, thank you. So it says here, this class is the most in-depth pain management course you will take. Let's see, we're going to talk about this. The purpose of this is deeper and more intensive training program to provide you with a deeper consideration for taking your skills to the next level. People are often scared in our world, don't you think, to work with pain? They get nervous about it.
Well, especially nowadays when everybody's have gone to pain clinics and ended up being addicted to opioids. So this is a big deal right now, basically finding a non-medicine way to take care of pain. So pharmacological care of pain management, and that's what we teach and that's what we've done. And it is a multi-billion-dollar business of which people are now reaching out for alternative therapies, and hypnosis is the best of those therapies.
Yeah, absolutely. Hey, I should not get ahead. I've assumed since I've spent some time with you years ago, and I kind of know your story. But for people who may stumble onto this video on their own at YouTube or on the Guild site or something, tell us a little bit about. Give us the quick version of how you got into hypnotism, would you please?
Well, it was in high school, actually. I needed a senior science project, and a friend of my aunt's had given me a book to read called Search for Bridie Murphy, which was about past life regression. I read the book, and right in the middle of that book, there was just it was a script. All you had to do is read it to put somebody into hypnosis, and it already talked about the ages being 9 to 17, the best ages, and I had a 14-year-old sister, so I had a client, I had a subject, I had a victim, and so I hypnotized her, but not really knowing anything about hypnosis. I mean, nothing. When I brought her out of hypnosis, I thought I would do the brother thing and have her howl like a dog. So I'm going to do a little stage stuff. And also, I didn't realize that I was bringing her out. I needed to get past the you're so relaxed stage and go into the awareness stage. But I kept saying, as I was counting her out, you're so totally relaxed. And at 9 o'clock, you're going to howl like a dog. You're so totally relaxed and so forth. Well, when I bring her out of hypnosis, first question she asked me was, what time is it? Because at 9 o'clock, she's got a mission. We walk into the living room and the clock starts chiming and she howls. It was funny. Arr! But what happened next wasn't funny. She collapsed in the floor, just totally. She was gone, totally relaxed, totally asleep. I didn't know she was asleep. I thought she had been knocked unconscious or something, but I couldn't wake her up. I couldn't get her out of hypnosis. I didn't have the experience. So I ended up dragging her to bed and throwing her to the bed. And luckily, my dad was already in bed. My mom, however, wasn't. And so the next day, I'm given the note, you'll never do that again.
Yeah.
But I did say a lot of prayers that night. Dear God, please, if you'll let her wake up, I promise I'll never cheat on another test. So that was kind of me that night. And then 10 years later, they were telling this story to my wife, and she started asking me to hypnotize her. And what was funny is I didn't know anything, but she trusted me. So she sent me to the library to get some books on hypnosis because that's how I'd done it before. Now, the next thing that happened was like a miracle. Within a month, my professional journal, I'm a nurse anesthetist by trade. I have to have continuing education credits, and my journal came out, and in the back of that journal was a 3-day course on hypnosis as an adjunct to anesthesia in New Orleans. And I went from the mountains of East Tennessee to the lowlands of New Orleans and took a course. And within a month, with 3 days, within a month, I opened a practice of hypnosis. And that was in '79, and I've been doing it ever since.
Wow.
And that's my story.
Wow. That is great. That is so great. Well, we'll get back. Thank you for sharing that. We'll get back to the main topic. I mean, so 79, so we're talking over 30, 40 years. Holy
Yeah.
moly. And have you ever even sat and tried to figure out how many people you think have come through your doorway?
Oh, it's been thousands because when I got into the military, I was doing a lot of hypnosis.
Yeah.
One of the things that happened was I got put into a pain clinic because of my background in hypnosis. I shared that with everybody. And so I got pulled out of the operating room one day a week, and I would see at least 8 clients, or the patients at that time is what I'd call them. So every Wednesday, I saw 8 patients. At one hospital, I helped with over 400 birthings.
Wow.
And at another hospital for almost 5 years, I did a monthly weight management group that never had less than 50 people in it. So when it comes to weight and I did smoking programs when I was out on the ships with the crew.
Yep.
So my experience, especially with groups and then and individually in pain and on the ships, I would see stuff like claustrophobia, sleepwalkers,
Wow.
people who were depressed.
Yeah.
Then a Desert Shield, Desert Storm, I was involved with it. So I've, I have had the opportunity to really get an unbelievable amount of experience to the point that the Navy actually sent me to the NGH Train the Trainer to become a CI, which is how you come into my life.
Yeah. Yeah.
And so I did a lot of military training at Camp Lejeune and up at Naval Medical Center Portsmouth and down at Beaufort Naval Hospital.
Cool. Cool. Well, and so again, I wouldn't expect most people to know this, but I did your 2-day, 7 or 8 years ago. I did your 2-day, and I enjoyed it so much that then I decided to go and do my CI training with you as well. And all these years later, I just had a really great experience. My partner Sandra had to have brain surgery. And
Wow.
yeah, she had an aneurysm. She's going to get a embolization of an aneurysm, and we did preoperative hypnosis leading up to her day of her procedure, and then we did postoperative hypnosis. And they wanted to use about seven different medications on her on the day of her procedure,
Hmm.
and we got them down to 3. We got them down to only 3. No, that was just what the sort of the 3-drug cocktail that they used to anesthetize her completely. They wouldn't let us use hypnosis, and they had a very good reason for the actual surgery, because since they were going to be running that catheter into her brain, they needed her to be perfectly still, and we
Right.
couldn't guarantee that we could make her be perfectly still during the procedure. So they said, sorry, you can use it before and after, but we got her up to the point, they wanted to give her stuff just to relax when she first got there. And that was just silly. That we knew we didn't need that. But then her post-operative, the nurses couldn't stop talking about it. They changed our rooms a few times. We get on different wings, we get different nurses. And every time we'd get into a new room, the nurse would go over her chart and say, you had brain surgery. And she'd say, yeah. And they'd say, all you have on here is Tylenol. And she'd say, yeah. And they'd say, when's the last time you took it? And she'd say, oh, I took it yesterday, but I haven't taken it today yet. And they said, what? They were just blown away, but it's because we just kept using hypnosis. So thank you for that, that help that you gave me years ago getting prepped for that. It paid dividends years later. It was really great.
Yeah, ever since 1979, when I became certified, uh, every patient that I've had, we're probably talking more than 30,000, got pre-op, inter-op, and post-op hypnosis or suggestions, and it did make a huge difference. And the
Yeah.
nurses in the PACU could always make a difference in the amount of pain medication, nausea medications that my patients had to have.
Yeah.
So from that, I've spoken to nurse anesthetists all over the country in big organizations, as many as 3,000-4,000 at a time, about how to use words as a way of changing the amount of medication you had to use.
Yeah. Yeah. So you guys, I mean, this is it. We don't, Ron's given you the basic overview of what we're talking about here. This is, your ability to come in and spend 2 days. This is immersion, right? This is a very powerful way of learning. immersion training. You commit 2 full days to being with one expert in his field and get a faster, a steeper learning curve, right? You can spend time on your own with books and other things, but I mean, this is your chance to steepen your learning curve, learn from someone who's done it a lot and who can say, I did this, don't do that. Which there's tremendous value in that too. And say, here's what I found really works best. And this is the kind of thing that's going to make you go back and put you in a better position to have a deeper practice of hypnotism, a richer practice of hypnotism, help more people, and be more sustainable in your practice. So 2 days, August 9th and 10th, Advanced Pain Practitioner Certification with Ron Eslinger. Ron, thanks for making this time for me.
You're welcome. Thank you.
All right, we'll see you in August.
I'll be there.